Hello everyone, I am Dr. Vivek. I'll talk to you about macular degeneration and how to deal with it in the present scenario. The macular degeneration is a fairly common retinal condition which is seen nowadays in both developed countries as well as developing countries because of increased life expectancy. So macula is an area in our retina which is related to or which works for the fine vision, that is color vision, reading, writing, recognition of faces and things like that. So this is where our clarity of vision remains. So this is the area called as macula. Degeneration means progressive weakness. Progressive weakness due to aging. So macular degeneration is in other terms called as age-related macular degeneration, AMD or ARMD. So as we all know, the aging and the degenerative process in every cell of our body gets started off by around 30-35 years of age. So we start getting older as we grow. So when we grow, the metabolic byproducts, that is whatever happens in the body, it gets broken down repeatedly, and those metabolic byproducts or waste products tend to get accumulated in various parts of the body. That is what manifests as cholesterol deposition in our blood vessels, which can lead to heart attacks and other problems. Our lungs get deposited with various metabolic byproducts, and that's how each and every organ tends to degenerate, that is progressively get weaker. Similarly, this process leads to deposition of fats and proteins which cannot be further broken down in the outermost layer of the retina. This is called as macular degeneration. So as we grow older, like from 35, 40, 50, 60, these deposits become thicker and more dense. And as they do that, they tend to damage the cells in which they are already existing, namely retinal pigment epithelial cells, RPE cells. So these are the cells which connect the whole of the retina to the outside of the retina called as a choroid. So when this RPE cell layer is strong and sturdy, it functions as a good border. So it keeps the retinal layer as well as the choroidal layer separate. This is like you have a very good solid border between India and its neighbor. So from the neighboring country, you don't have infiltrators coming in and troubling us. So that you have a good solid border. But as the age advances, this RPE cell tends to get weakened because of these deposits, and that's how this border becomes weaker or porous, and then the infiltrators or the peronests start migrating inside. From the choroid, the blood vessel starts penetrating into the retina. So the initial stage where there are only deposits inside the RPE cells is called as a dry AMD stage or a dry age-related macular degeneration stage. As the deposition increases in some people, a few or a small cluster of RPE cells tends to break down, and the blood vessels from the choroidal layer starts penetrating into the retina. This is called as a wet stage. The end stage of all this will be a totally or a widespread destruction of the RPE cells, which will lead to further, because RPE cells are very crucial for the functioning of the retina. Further, other 9 layers of the retina also tend to get destroyed, or they tend to get weakened, gradually leading to what is called as end stage of AMD called as geographic AMD. So the first stage would be dry AMD, somewhere in between wet AMD. Otherwise, dry AMD to geographic AMD. Otherwise, there will be an in-between event called as wet AMD. Again, that will also either become a scar or a geographic AMD. So this is mostly about macular degeneration. So as I told you earlier while introducing the disease, it's more likely because of our life expectancy has increased. Not only in the developed countries like Europe and America, even in India we see lot many people being alive into their 80s, 90s. So as we grow older, these conditions tend to become more and more common. So when I was studying, preparing to be an ophthalmologist, we used to see far fewer cases. Now, at least 25 to 30% of my retina cases constitute these type of diseases. So, it's a fairly common problem, particularly so with our population and the elderly who are living longer. We tend to see many of these people with problems. As with any other retinal condition, the importance lies in the early diagnosis and timely treatment. So, with early diagnosis, we can pick up the disease at a very small stage or very early stage. With minimal treatment, we can maintain the disease. Whereas, the same thing, the patient defers the visit to the hospital or because of various other reasons like COVID and other things, or there might have been an event in the family, or they might themselves have had another health issue like a heart attack or a stroke or some kidney problem or something or the other, which is also common in this age. They tend to visit the eye doctor later, during which the condition would have progressed to a much advanced stage. Then the vision would be much lesser, and the number of treatments that needs to be given and the duration of the treatment will also be much longer. So, as in any other retinal condition, earlier the diagnosis, lesser the treatment, better the outcome, lesser the expenditure. Later the diagnosis, poorer the outcome, more the treatment, more the expenditure. So, it's very directly proportional, very simple logic. If people because they are unaware, they tend to postpone it thinking that this could also be a cataract because this is the age in which most of them will have cataract as well. So thinking that this is cataract, will get it operated tomorrow, 3 months later, or 6 months later, after my child delivers the baby and things like that. So they keep postponing due to various reasons. What I would suggest is, whenever you have a visual problem, please don't wait. At least get it checked. See, if it is, I'm not saying that with cataract you delay the surgery, but you have a cushion, you have a maybe like 2 weeks or 1 month, even if you wait for a cataract surgery to be done, it won't matter that much. But whereas in cases of retinal conditions like macular degeneration or glaucoma, even that 2 weeks, 3 weeks, 1 month delay can lead to a massive deterioration of vision, which can never be recovered. Because the vision loss in cataract is generally reversible, whereas in that of retinal disorders or glaucoma is irreversible. So what we can achieve is only maintenance of whatever vision you have, you come to us with. So it is very important for every one of us to have that awareness in our mind that at least let us get the diagnosis done. So if we have the diagnosis, then at least we know whether we have that, we can wait and things like that. So what does this macular degeneration, how does this present? Typically, people present with when it is early, that is like in dry AMD, generally there are more symptoms. People are quite comfortable. Only when we check the retina by dilating and putting drops and checking the retina, that is when we will realize and they will realize. But when the dry form goes into a wet form, that is when the straight images starts getting distorted. So if you like look at the window sill, what has to be straight will appear wavy. The edge of the refrigerator, instead of being straight, will start appearing wavy. The letters, when you try to read, you are seeing the letters, when the letters appear jumbled up. You start seeing one letter above, one letter below. So these are kind of distorted images, smaller, larger images you start seeing. And apart from that, you also feel that your vision is getting blurred, difficulty to recognize faces and things like that. So when you come with such complaints, we dilate the retina, eye, and then check the retina, do a couple of scans, and then we diagnose this. And the treatment would be in the form of injections mostly. And injections will have to be given repeatedly and at timely intervals, typically at 4 weekly intervals. So generally, whenever I say 4 weekly, people say, oh, okay, monthly. No, it is not monthly, it is 4 weekly. The norm is when I start the injection today on Monday, 4 weeks later, 4 Mondays later, you are supposed to get the second injection. So that is simpler to remember because monthly means you might miss out on a few days and delay the treatment unnecessarily. So it is 4 weekly. And adherence to treatment regimen is very crucial for you to get the best out of it. The same 3 injections given over 6 months might be a waste of time and money, whereas 3 injections given over 8 weeks would probably work well for you. So, and regular treatments and follow-up. We are not talking of, see, it's like if we don't treat the condition, that vision will deteriorate like this. There will be a sudden steep fall. If we treat the patient, then there can be a shallower fall and somewhere in between it might remain. So I'm not saying I will retain your vision at this level, but instead of falling it to this level, we might probably save it to this level. And for more years, instead of 3 months it will fall, you might fall, maybe you might end up with that kind of vision 5 years later or 10 years later. So be aware of the condition, get yourself checked and take appropriate treatment at the right time. Don't delay the diagnosis, that is the most crucial thing. Thank you so much.